Good afternoon, Chris Fawcett from the Headache and Pain Management Centre, and today is day 2 of National Headache and Migraine Awareness Week, and today we are talking Tension Headache Tuesday. So we're talking all about tension type headaches and the joint that is most affected in tension type headache sufferers. If you are suffering tension type headache, type in below tension, and it'll know that this is related to you. So as you've heard from other videos along the way, if you're a regular sort of viewer of these videos, basically what we know about tension headache, about migraine and other types of headache and migraine conditions is that it's sensitized by the system at the back of your neck, okay? Top of your spinal cord, bottom of your brain, and your neck is what can actually sensitize that system in the first place. What's really interesting is that when it comes to tension type headache, and for those who don't know what tension type headache is, what it is, it's this really frustrating. That's the word that a lot of patients use. Frustrating, annoying. Good afternoon, good to see you there. Type in below, say hello if you're there. And what it is this real sort of feeling of sort of real tightness and compression, either right through the front of the head, like it feels like a vice on their head, or it feels like they're being squeezed through the temples. And some people even diagnosed with tension type headache, it feels like there's a baseball bat, like a real compression right at the back of their head, like it feels like there's a real squashing feeling. And some people, unfortunately, they feel like the whole head is just being stuck in a vice. When you've got tension type headache, it's actually really difficult sometimes to find the right treatment for it because it's really intransigent, it's really like stubborn, it's really just stuck there, it's frustrating, and you don't know what it is that you can do to help it out. Well, I'm here to tell you that when it comes to tension type headache, there's usually one joint which is most affected, and that joint is the top joint of your neck. So it's the joint between your skull and C1. So your skull, which is, oh, we've got one here. So what you've got here is your skull. So this is at the back, by the way. So there's your skull, and there's C1, and there's C2. So if you have a feel at the back of your neck, what you find is there's a bumpy bit. Okay, so there's a bumpy bit in the back of your neck, right at the top. So if you run it down from the top of from your skull down into your neck, and that first bumpy bit that you feel is actually the second vertebrae. That's number 2, okay, right in through there. Whereas where we're looking is actually the joint which is right above that. So it's where the skull, right here, meets the top joint there. Now, why is this joint so important? So that joint at the top of the skull is actually responsible for most of your nodding. So it does that type of movement, okay? So it's head on neck movement, it does that. And if it's tight and stiff, it restricts the movement in the front to back direction. So it doesn't allow you to nod your head all that well, and nor does it allow you to sort of draw your head right the way back. So if it's not very happy, like it's a bit sensitive through there, a bit tight, what can happen is that joint becomes the sensitizing factor. It's what sensitizes the brainstem. It's what sensitizes the system to have the tension headache happen. Cool, so that is where it's at. So this is what it looks like, and this is the skull. Now the reason why it's so important is because, look, I'm going to be careful here because I don't want to scare people. This is all like just the bones. So normally there's a lot of like ligaments and muscles and a lot of tissue that holds it all together. But this is just here to give a bit of an illustration. So if we look underneath, you can see that the joint surface in between the skull here, okay, so this sort of convex type surface, and this concave surface, which is here, okay, so they roll on the joint like that. So they kind of roll, translate, and come forward. So there's a lot of nodding. So there's a lot of movement sort of in that plane, kind of like that, so it nods the head really nicely. So if you're stiff at that joint, what it does is there's not as much nodding and not as much being able to move up and down. And what happens is that the soft tissue around it hasn't got a chance to actually move a lot. The muscles around it tighten up and it feels that real tension type feeling at the top of the neck. And what can happen then is that because of where the joint is and how it refers, it then refers pain into your head. So it refers pain into your forehead, it can refer pain to the back of your head or around the side of your head. So really like a compression type feeling. And depending on exactly the joint and the direction exactly of which joint, it will determine where the pain actually is. So someone who has both joints which are affected, it will have like a real compression type feeling like this. If it's one side, just one joint that's stiff, it can be sort of right at the front of the head on one side. And if it's sort of out wider, so instead of being like a nodding direction, it's a little bit of a rotating direction where the problem is, it can bring the headache out to the side. It can bring it sort of into the temple rather than at the back of the head. Or you can be very unlucky like some people and the headache just moves around like this all over the place. So you can have it here one day, there the next, there the next, there the next, and it can be really kind of confusing. So people with tension type headache, what's really important is to get the top of the neck checked. Okay, so actually having the top joint moving nicely before you do anything else with it. Now here's a secret, okay, so if you've been to see a physio before about your migraines or your headaches, you might have been given an exercise called the deep neck flexor exercise. Now you might have done this one before where they put a bit of a pillow underneath the neck and they get you to do little nods like this. Now that exercise can be really, really effective for people with neck-related headache, okay, because it strengthens the muscles in the front of the neck and does a really good job with that. The research shows that's great. However, here's the negative to it. If you've got a stiff joint at the top of the neck and it's not nodding very well, or the movement of that joint is kind of sensitizing your system more by doing it, we need to make sure that that neck joint is moving nicely first before we even think about doing those deep neck flexor exercises, because sometimes what can happen is that when you do it with a tension headache or a migraine, it actually makes the symptoms worse. And the reason is because we haven't done anything to make these joints move nicer and have your brain kind of settle it down so it's not as nasty when you do it. So just be mindful of that. If you've actually had those exercises from the physio before and you've found that it's made your headache or migraine worse when you do it, so the nodding one like that, if you're finding that that's made it worse, then it's actually really good to have a check and see what's going on with the joint itself rather than the muscles itself. We're getting a big audience here. Good afternoon. Please type in and say hello. Yes, we're just talking about tension type headache today and what's happening and which joint is actually the biggest cause of that. So as I was just saying before, it's the top joint of the neck. So it does like this, and you can see where it is. It's a very big convex concave kind of joint which rolls really comfortably, does a lot of nodding. And that joint on its own can refer pain straight into here, straight into there, or around the side of your head. So it's really important to get that checked out. What also is really important is to make sure that its little brother at C23 is also checked too, because they both go out in crime together. G'day, John. Good to see you there, buddy. If you've got any questions, type in below and we can get to that either through the video or afterwards in the comments below. So that's pretty much what's going on with the tension type headache. It's the top joint. Get it checked out and make sure it's done by someone who knows what they're doing, someone who knows how to treat headache and migraine. What I will say as a tip as well, someone who's got tension type headache, if you're getting sort of manipulation or it's getting a bit of a cracky stuff, g'day Cargie, good to see you there. So if there's, you know, rotational stuff, cracky stuff, and it's not getting anywhere, then it's actually the front to back direction which needs more work rather than the side to side one. So that's a question we're often asked as well, is that we have had that C1 joint treated before, you know, with some interesting techniques in the past. And what goes on is that they've treated the wrong direction. G'day Adrian, good to see you there, buddy. For those playing at home, my nickname is Farah to a couple of friends of mine because my last name is Fawcett. So Farah Fawcett, the Charlie's Angel. I haven't got the hair for that. So when we're talking about tension type headache, that's what we're talking about. It's OC1, it's the top joint, getting it moving front to back, to get that moving nicer, let the muscles go so that there's less pain going through the head. If you've got some tension type headaches and you'd like us to help out, or at the very least actually just start a conversation with you offline, just type in tension below and I can start a conversation with you about that, because yes, tension headache is really common. We see it every single day here at the clinic and we do want to help out as best we can. And what I will say as well, that it's actually National Headache and Migraine Awareness Week, and tomorrow we're actually putting out something in the morning which is very exciting for all of our followers, so look out for that around about 9 o'clock tomorrow morning, maybe a little earlier. The status will be there for you, so make sure you check in to see what that is all about. Hope you're having a really good Tuesday, and we'll be back tomorrow with Weird and Wonderful Headache Wednesday. We'll be talking about a few of the weirder type of headaches and migraines that can be caused by the neck. Cheers, have a good afternoon, and I'll see you tomorrow. Thanks, bye for now.